Our next presenters are Drs. Deborah Bowen and Melody Goodman. Dr. Bowen is a professor in the Department of Bioethics and Humanities at the University of Washington School of Public Health and is currently coordinating or working on several studies applying new innovative technologies to improve people's understanding of their risk for disease and their interactions with healthcare and health promotion. Dr. Goodman is an associate professor of biostatistics in the College of Global Public Health, at New York University, and is an expert methodologist with a large statistical toolbox that includes knowledge of a broad array of analyses techniques. Their presentation, Quantitative Measures to Assess Community Engagement in Research, will highlight the results of a systematic review of stakeholder engagement measures, as well as preliminary results of their efforts to develop and validate a better measure of stakeholder engagement for use in ongoing research projects. As a reminder, if you have questions during the presentation, please ask them in the chat box. After the presentation, I will lead us in an interactive discussion with reactors and conference participants. That said, Deborah, are you ready to begin?
We're ready.
Thank you.
Good morning, or good afternoon by now. Thank you for asking us to present. I think the morning's presentation, or the early afternoon's presentation allows us to follow quite nicely because we're going to talk about our efforts to develop specific quantitative measures of how engaged stakeholders are in the process of working together with academic folks on research projects. So we're going to talk you through our steps, and we're going to show you data and findings that allow us to be able to develop a strong instrument that would be able to be used across projects, we hope, and would inform how engaged people really feel and where their engagement processes lie. So first, here are some colleagues that have actively participated in this research. Partly this is a good slide to have because if you need to get in contact with me or with Melody for any follow-up activities like, gee, I'd like to use your instrument, can you send me a copy? Or, gee, I'd like to get a copy of your paper. Please go ahead and email us and stay in contact with us and use these emails to do so. So the earlier presenter has done, I think, a great job of introducing this topic. We started this plan several years ago when we first sat down to define how we'd like to measure community engagement, meaning how engaged people are, how involved and how excited and how much they're willing and ready to play with us in the academic community partnership realm as full partners. So we pulled this definition from the various definitions that are out there. This is a field that, as you know, if you've read any of this stuff, is defined in multiple ways, and some of them are contradictory a little bit. So we had to choose a definition that we thought best encompassed what we defined as community engagement. Key elements of this definition include the words collaboratively, groups of people, the affiliation. What is a stakeholder really is an entirely separate question. Where do stakeholders come from? How do we find them? How do we work with them? Who should they be when you sit down to design a project in increasing care used to decide about, for example, cesarean section? Who are the stakeholders in such an effort, and who should they be, and who might they be, and who wants to play a role as a stakeholder is a very complicated question. But most of us believe that community engagement is a powerful tool for doing better research, and that's the fundamental reason for doing community engagement. As I think the earlier presenter has spoken about, community engagement takes time. Gosh, it would be so much easier if I could sit in my little windowless office and plow out through research activities all alone. It's mostly very easy and mostly potentially very wrong. What community engagement does for an academic person like myself is to ensure that some of these good things happen or help them to happen. We ask better questions. We hope that we create better sustainability interventions. We increase the relevance of the project to stakeholders if we understand it. And I'm speaking about we, meaning we the academics, but certainly all of us together. That trust-building activity is key, as we've heard several times already today. There are resources that community members and stakeholders have that academic folks don't have. And so combining together with us is often a really great strategy for getting the work done that you want to get done. Underlying community engagement is a sense of reciprocity, I think, in the way that we define it. And so we've struggled over the past several years to understand what reciprocity really means and to apply it. Not always easy, not always fun, but certainly ultimately we hope rewarding. Here are the kinds of things we decided early on that we wanted to know. What happens when you initiate a community-based project? How does engagement develop? And then does engagement change our outcomes? In other words, if we're doing a project to change cesarean rates, if we work together with community members to effect that change, will the outcomes be better? We hope that they will. We believe that they will, but mostly scientists like to look at data about whether or not they are. So being able to evaluate that, in other words, measure it and relate it to some other measure of outcome is the key for us. We needed to find tools to measure community engagement in our stakeholder groups and better understand the engagement process through that measurement. Here are the activities that we've been working on this topic over the past 4 or 5 years. We first, like any good scholarly effort, we sat down and did a review. We wanted to understand what the tools were that were out there published now. We then sat down to develop a new measurement because we didn't see the tools that we wanted. We wanted a more specific tool that measured the quality and quantity of engagement and the stage of engagement, as well as whether or not someone was with the program. And then finally, in order to advocate for the use of this measurement around other projects, our projects and other people's projects, we felt that we had to understand how the measurement was performing. And so it just, in terms of confession, my background is as a psychologist. Melody's background is as a biostatistician. And together, those backgrounds allow us to understand the psychometric properties, the performance properties of a measurement. So in other words, we're able, we will hope at the end of this effort, we will be able to claim the tool that we're developing as a good, solid, reliable, valid tool. And that goes a long way with researchers. It goes a long way in getting your PCORI grant, if that's what you want to do, or your NIH grant, or your Canadian federal grant. I think, or any grant that must be reviewed by a peer review process. It goes a long way to say that we have a tool that we trust. We have a hammer that we trust, and we're going to use that hammer to measure something that is important to the project. So that's our mission, encapsulated in these 3 elements. First, we conducted a systematic review. So a systematic review is a review of the existing published and publicly available and otherwise available, if you want, literature on what tools are available. We knew that tools existed. We knew that people were using methods of evaluating their partnerships. We didn't know what they were, and we realized as we sat down with colleagues together and discussed this in our research group that that people had different views. It's kind of like the elephant joke, right? Where people who can't see put their hands out and feel different parts of an elephant, and feeling the trunk is completely different than feeling the tail. You'd believe that you had your hands on a different animal if you felt the trunk as compared to the tail as compared to the leg of an elephant. In the same way, we found that everybody had their favorite measure, but nobody really understood which one was better, or which one we would choose, one over the other, or why one would choose measure A versus measure B. When you find yourself in that setting, you have to do, for me, you have to do a systematic review. Everybody measures something, but we had to figure out, we had to directly head-on compare these measures to see which one was the strongest methodologically, which one had the most data behind it. Maybe the work had already been done. Maybe we didn't need to develop a new measure. That would be great because we could go ahead and use the hammer that had been developed and found reliable and valid. Well, here's what we found. And I'll give you the reference to this or send it to you if you want to email me. The article, it's published in a peer-reviewed journal, but I can send you the PDF of it. We found basically that the measures that existed in 2015 sorted themselves into two camps. One camp were counts. People counted things. People love to count things. And I think the previous presenter has alluded to those measurements. Counting people who show up at meetings, counting attendance, counting the numbers of people who do things, who participate in events, or who try to have input, is one way that engagement has been measured. And there are pros, as you might imagine, there are pros and cons to that count methodology. A second way is to try to measure some construct that is related to or that is seen to measure engagement. And I'll give you some examples of those. So we might measure perceived involvement, for example. We might give people a scale and ask all the stakeholders in a project to rate how involved they feel on a scale of 1 to 9 using 6 questions that measure different kinds of involvement. Do you feel like you're involved in this project's design and evaluation and interpretation and publication and use of tools, et cetera, et cetera, et cetera? There were several of those projects and papers that evaluated measurement tools that measured a construct or two that are relevant. What we found in a nutshell is that the measurement properties of any of these measurements were very poor. In other words, in our PCORI grant, we couldn't claim that any of them in that year, and in the years that we evaluated, previous to 2015, had any sort of what I would call psychometric data associated with them. People rarely reported inter-rater reliability. In other words, if I measure something today and I measure it tomorrow, and I measure it among different kinds of people, would I expect to find the measurements similar or different? And what did I find? Well, nobody's really looked. Nobody's really evaluated that. Nobody's published it anyway. Similarly, in terms of validity, how do I know that the construct of perceived involvement, how do I know that that's the key construct? Well, one way one does that is to look at its relationship to another measurement that is actually a measure of engagement. Nobody's really reported that as well by the time of our review. Mostly, nobody looks at the relative impact of engagement on outcomes, which was really our key question, our essential question. Does engaging stakeholders in a research project make it a better research project? Certainly these were not tracked over time. Often they were single measures, basically stuck into it looked like to us they were stuck into a paper to say, yeah, we measured that stuff. people are into this project, let's move on. And we didn't really get a sense of how engaged they were, whether or not that engagement continued over time, or whether it was relevant to the choices that got made in the project. And these were all questions that we felt like we wanted to answer. Specifically, here are some examples of the counting method. These are in our review, and you can take that review paper and take a look at it and get a sense of whether you like these measures. We felt like they were very unsatisfactory. They're certainly part of the answer. If people don't show up at your party, you're pretty much not having a party. So we thought that some of these counting measures were useful, but they didn't tell us the whole story. Similarly, here are some of the construct method examples. And we felt the same way about these. They are certainly telling us part of the story, but they're not giving us a measurement of engagement. And besides, for most of these measures, we have no full understanding of whether they measure what they say they're measuring, or whether they're measuring it in a reliable fashion. We simply didn't know because people didn't report it. And again, being scientists and being people who write grants for a living and generate research dollars for a living, we felt like it was both our job and our responsibility to be able to answer some of these questions about a measurement tool, about a hammer that we would get behind, that we would use repeatedly in all of our different projects, and we would advocate for use among our colleagues. So we felt like the literature from our systematic review was inadequate to be able to do what we needed to do. So that's the usefulness of a systematic review for figuring this out. We had to start somewhere, and we had to understand where we were starting. So we sat down, and from here, I'm going to ask Melody to take over. We began to think about, well, okay, if the literature is inadequate and doesn't give us what we need, what would we want to see in a measurement tool? What would we want to measure? How would we phrase that measurement tool? And then what would we do to development? Melody?
Yes. So as Deb mentioned, this really stemmed from our own work trying to evaluate some research that we were doing as part of a center to address cancer disparities. And the center used community engagement approaches, and we had lots of great anecdotal evidence about how engagement works. But when our funder asked us to show how engagement had impacted our science, we realized that we didn't really have a measure of engagement, and so there was no way to show an association with that in terms of some of the outcomes that we wanted to look at. So we worked with our Disparities Elimination Advisory Committee, which we affectionately call DEAC, and we went to the literature and we looked for engagement principles. So we found the principles of community-based participatory research and the principles for patient-centered outcomes research, and also some principles that have been developed by community campus partnerships for health. There was a lot of overlap, but we ended up, with the help of our community partners, agreeing on the 11 engagement principles that you see on the screen. It's important to note that we were looking for things that we could measure, not just all aspects of engagement. So there may be some things that people think are missing, but these are the ones that our community partners at least felt were important to think about when you're measuring the impact of engagement, that you should think about these things. Focus on local relevance and determinants of health, acknowledge the community, disseminate findings and knowledge gained to all partners, seek and use the input of community partners, involve a cyclical and iterative process in the pursuit of objectives, foster co-learning, capacity building, and co-benefit for all partners, build on the strengths and resources within the community, facilitate collaborative and equitable partnerships, integrate and achieve a balance of all partners, involve all partners in the dissemination process, and plan for a long-term process and commitment. We also were thinking about how do we classify the levels of engagement seen, and this figure is from a commentary written by myself and Dr. Thompson, just thinking about how do you classify the levels of engagement. And we really sort of put them in three bins. Non-participation, that's really where you're doing more outreach and education, so you're not really engaging the stakeholders in the process. What we called symbolic participation, where sometimes you bring people to the table, but you don't really let them say anything. And then what we really sort of hope for is engaged participation, where people come to the table and are active participants in what's going on. So Deb mentioned, I think, that we have a PCORI grant. PCORI is the Patient-Centered Outcomes Research Institute. And PCORI has been really interested in methodology around engagement and really trying to assess the science of stakeholder engagement. And our grant was really to take that measure that we had developed and to validate it, but also to shorten it and make sure that it was feasible for people to implement in other studies. So our grant has 4 specific aims. We wanted to examine the construct validity of each engagement principle, and we were trying to measure on 2 scales, one that measures quantity and one that measures quality. I think really from our community stakeholders, people talked a lot about you can do something poorly really often, or you could do something really well and not so often. So they felt that we needed to assess both quantity and quality. And we used the standardized Delphi process for expert validation from advocacy groups, patients, families, and other sort of key stakeholders in the process. We also wanted to examine the psychometric properties, specifically reliability and sensitive to change, and correlative validity with other key measures that we thought were out there, and that could also help us determine cutoffs for levels of community engagement. Our third aim is to really create a shorter version of the measure that could be used in studies. And then our fourth aim is more sort of an implementation study where we're going to work to implement our measure in current patient-centered outcomes research or comparative effectiveness studies to really see how it works in practice. So our first aim was really to do content validation, and so we used a Delphi process with a group of experts. We used web-based surveys for 4 of the rounds, and then one of the rounds, round 4, was a 2-day in-person meeting, and then our final round was just another web-based survey to reach consensus. We also are going to talk a little bit about sort of the participant surveys that we're using to get some data for psychometric analysis. And throughout this process, we really wanted to make sure that engagement was key. So we report quarterly back to the Disparities Elimination Advisory Committee, which is our community advisory board that's been working with us for several years as we've worked to develop the measure. And then we've just recently finished doing some cognitive interviews, which is people sort of using the measure and making sure things read right and people understand what we're trying to ask them and can respond accordingly. So the Delphi technique, for those of you who don't know about it, is really a method for collecting and organizing informed opinions from a group of experts. And we use sort of an iterative process that is often used in survey instrument development. The approach is most appropriate to ensure feedback is obtained from all stakeholders, with all experts being treated equal and everyone's voices being heard. We thought this was really important because we do have academic researchers and community health stakeholders as experts on our panel, and we wanted to make sure that the voices of academics didn't appear louder than the voices of some of the community health stakeholders. When we did the in-person meeting, we also used some live polling so that we could really see where things were in real time. And we really think the use of the Delphi technique afforded us the opportunity to use a stakeholder engaged approach to measure development and validation, which really has not been done before. The responses to each of the Delphi surveys were analyzed by the project team, and then we returned it back to the Delphi panelists for further consideration and their response. Even though the goal of the Delphi process is to reach consensus, we did not want to force consensus, and so it was important for us to figure out if there were spaces where just consensus could not be reached. And so once we reach consensus, subsequent iterations of items are shown back to the panelists until we get to a version where we think we are final. And like I said, while panelists are encouraged to reconsider their responses, so when they get their Delphi report, it shows them their responses, but it also shows them in aggregate responses from other panelists. They can change their response, or they could decide to hold firm and think that, you know, they really sort of disagree with where the consensus was going. Our outcome was to reach 80% consensus among experts, and like I said, we did not force consensus. So for items where consensus could not be reached, we discussed those at the in-person meeting to really get a sense of what those nuances were, if it was wordsmithing or other things that wouldn't allow us to reach consensus, or if there just really was not consensus on some of these ideas. But ultimately, we were able to reach consensus. So our expert review panelists come from all over the country. A lot you'll see from St. Louis, because that's where sort of our community work started, but we have people from Kentucky and North Carolina and the like. We started with 19 members of our expert review panel. 18 of them stayed engaged throughout the entire 5-round process. 10 of those were community health stakeholders, and 8 of those were academic researchers who do community engaged or patient-centered research. So one of the things that I think is really important to mention is that we thought, because engagement principles had existed in the literature, that it would be fairly easy to reach consensus. And one of the things we realized really early on is that not only did we have to reach consensus on the engagement principles, but we had to reach consensus on definitions for each of those principles, making sure that we agreed on what each of those principles meant. As we move to phase 2 of our study, we are recruiting participants that are going to take 4 web-based surveys over a couple of months. We're looking for people who have been community health stakeholders, who have participated in community engaged research studies. Participants can complete these surveys from home, from any mobile device that has an internet connection, and they can start and stop as many times as they can. We're giving people nice Amazon gift cards for completing the surveys. And because there's so many, there's basically increasing incentives for the longer you stay in the study. So surveys 1 and 2, you'll get $10 each, but they'll get $25 if they complete both. And similarly for surveys 3 and 4, you get $15 each or $40 if you complete both. And this has been really beneficial to us to make sure that participants stay engaged and are completing all of the surveys across the 4 different waves. This slide is a little bit outdated, but it was where we were at the time we submitted the presentation. So it says we have 123 people enrolled. At this point, we have almost 300 people enrolled, so we're getting close to our goal target of 500 participants. As you can see, there's variability over the number of people who completed the surveys, but we're sort of making sure that if people completed one survey, that they know about completing future surveys or subsequent surveys. And one of the things that we are really trying to keep track of is making sure that originally we had thought we would only recruit participants from St. Louis and Seattle, but as we started doing this work, we realized that there may be some geographic variability, and it would be better for us to recruit a national sample. So we're really mapping out where our participants come from, and to make sure that we're targeting people in spaces where we don't have any participants yet at the moment. So like I said, this is a bit outdated, but you can see still most of our respondents are coming from the St. Louis area, and then a bit from the West Coast, and then also from the East Coast area. So currently, which universities are represented in our survey? We have a bunch of people from Washington University in St. Louis, which is where I used to be, and also St. Louis University and the University of Missouri. We have some participants from NYU, Northwestern, the University of Washington, Penn State, UNC, and University of Illinois at Chicago. There's lots of other institutions represented by 1 or 2 participants, but these are the ones that had more than 5 participants from a specific institution. So really we're interested in the psychometric properties of the measure. Are the items that measure a single engagement principle internally consistent with each other, meaning are they measuring the same sort of thing? So we use Cronbeck's alpha to look at internal consistency. It's a measure that goes from 0 to 1, and 0.7 is considered acceptable. And then we also looked at how well our measure is correlating with other measures that we assume that it potentially would be correlated with. As Deb mentioned, there is no gold standard measure, but we have assessed some other measures of engagement to see how our measure will perform against that measure. So when we have the 11 engagement principles, there's 3 to 5 items that measure each engagement principle, and we ask them on a quantity scale and on a quality scale. And this slide is just showing you that all of those items are internally consistent with each other. So the 4 items that measure engagement principle 1 have a really high internal consistency, meaning it looks like they're measuring the same thing, which is an important property of good scales. Now we're we've revised our measure based on our Delphi process. And so we went from 11 engagement principles down to 8. We actually dropped 4 engagement principles, and some of them were combined. And we added 1 engagement principle around trust, because that was one of the things that our original list of 11 didn't have, that our community health stakeholders felt were really important to gain. And as you can see, the number of items in each, that measure each engagement principle is changing over time, but we're in a place again where we have about 3 to 5 items that assess each engagement principle, and it still shows strong internal consistency. So the items that are measuring a principle are related to each other and look like they're measuring or trying to get at the same construct. And then we thought it was important, because there was no gold standard measure of community engagement that existed, in order to validate our measure, we wanted to look at how it performed in relation to some other measures. And so we looked at the medical mistrust scale and also the trusted medical researcher scale. And even though those are measuring different constructs, we thought that our measure should be at least associated or correlated with those measures. And we also looked at the partnership assessment and community-based research. And another measure that was proposed by Kagan et al. That looked at community partnerships, particularly in HIV AIDS trials. And even though our sample size that we're using here is still the small sample, it's still with 100 or so people, you can see that we're already starting to see some significant results. And so we think once we have our full sample size, we'll really be able to show how our measure performs against other measures. One of the measures that we thought it was important, there is a community engagement and research index. And so we're really looking at how our measure compares against that. And there's also a correlation self-assessment measure that assesses trust. And because we newly added that principle, we felt like it was important to make sure that we validate the trust part of the measure that we are developing. So we are still recruiting, and so if there's anyone on the call that would be interested in participating in our study or have community partners that you think would be great for our study, our link to complete the screener is in the PowerPoint. And basically you complete a really short screening instrument that tells you whether or not you are eligible to participate in the study. Again, we're looking for people that are over 18. You have to have access to the internet to participate in our study. We're looking for people all over the country, and we just ask that they have participated in some community engaged study, but we're looking for people that have been across the spectrum, so they don't have to have had a lot of engagement, just some minimal engagement in community engaged research, and so the screener will test for that. And that's where we are. So I guess we'll take questions.
Thank you so much, Melody and Deborah. That was a fantastic presentation, very interesting. At this point, we're gonna start a Q&A discussion. Before we begin, I just wanted to remind people and encourage you that if you have any questions or comments for Melody and Deborah, please do not hesitate. Just type them into the chat pod, and we'll make sure to address them at this time. And so, to start us off, or actually rather, before we begin, I just want to reintroduce our reactors today: Shauna Crane, Susan Magacy, and Rylan Rogers. Before we turn over the discussion to them with some questions that we had sent them ahead of time, I do want to address some questions from our chat pod. So the first question comes from Rosman. Is there a seminal paper that describes the Delphi technique that you can share? And Melody, I believe that this is in common to one of the slides you presented on. I'm wondering if you could describe any sort of papers that are out there and how folks might access them.
There's a lot of papers about the Delphi process. We haven't seen many papers about using the Delphi process to do sort of stakeholder engaged measure development. And we've just submitted a paper on our own work to disseminate this, but I'm happy to share with people. There's actually a really good book, and I can't think of the name, that we used, and some key papers on how to use the Delphi process in health research.
Thank you. And another question that we wanted to bring up to both you, Melody, and Deborah, just wondering, is there a way for folks who don't necessarily have access to an academic library to access your systematic review?
Well, if you email me, I'll email you the PDF. I appreciate that the access to an academic library that's what gets you the PDF. And so I'm happy to email you the PDF if you email me using the email that's in the slide set.
Thank you so much. And again, folks, if anybody has any questions or comments that they would like Melody and Deborah to address, please do not hesitate to type them into the chat pod. In the meanwhile, I want to turn over the discussion to our reactors. And our first question is for Shauna. Can you share an experience from when you participated on a stakeholder panel that fostered co-learning, capacity building, and co-benefit for all partners?
Thank you. As before with the first presentation, my perspective is just a little different because we're not doing research here. We're training stakeholders of how to work together on advisory groups or panels or that sort of thing for states, for different organizations. But an activity that we do, which has really fostered co-benefit for all partners, including the sponsoring agency and the stakeholder group that's providing them feedback, is to do a priority setting activity. And we use a method called a consensus workshop that comes out of the TOPS training program. It's technology of participation. And you use a sticky wall and cards, and there's great involvement from every single person in the room, every stakeholder, so that regardless of their role on the panel or what capacity they're filling, whether it's a parent or a agency member or some other thing where all of these people come together in an advisory or stakeholder capacity, their voice is heard, and the priorities for the group to work on over a given period of time are a combined effort. And so that consensus workshop priority setting is something that really helps foster that cohesiveness as a group and a shared mission and purpose for stakeholder panels.
Thank you so much, Shauna. Moving right along, our next question is for Rylan. Can you share an experience you've had that excels in having a true partnership with stakeholders, and how is that relationship built?
So I really appreciated this presentation because of the real frame about how do we think differently and how do we move past counting to really look at the quality and what matters. From my perspective, the richest experience in terms of having a true partnership is when stakeholders have been engaged from the very beginning of even project design. Really framing what the question is, being part of the grant application. I think those beginning contributions in a leadership partnership way transform the work in terms of making sure that whatever the point of inquiry matches the needs of the population that's being addressed. And it also transforms the work in terms of some of the increased engagement over long-term studies. I loved the question earlier about how do we maintain and for long haul. And I think a key part of that is making sure that the questions being asked in our research are informed from the beginning and really in many cases designed in partnership with the stakeholders. I think that flip in the order and the foundational premise In a lot of ways, I always think of it a little bit as the promise of PCORI, and starting to see it influence our work across the different funding models.
Thank you, Rylan. And I'm curious, Shauna or Susan, if either of you have an experience that you could share in terms of where you formulated a partnership with stakeholders that's really excelled and really helped your project.
This is Susan, and the work that I do is primarily looking at promoting healthcare justice for people with disabilities. So looking at issues of healthcare access, healthcare quality, and healthcare outcomes. And that really emerged from a long-term partnership, all research done using a community-based participatory approach, starting with initial conversations, just like you were saying, about a community-identified need that the research partners and the community partners had a shared commitment to and passion to. And we have used that not as part of a research study, but I would say as a line of research that we have been able to build and nurture over the course of, I think I counted last night, and it was 8 different research studies, each one from a different funding organization, but that we've been able to build on, starting from some really exploratory work, just understanding what the community experiences and needs were, to progressively more intervention research, finding ways to build evidence-informed interventions to meet and address those needs. So really seeing the community as those co-creators of the research questions, where we bring our expertise in terms of research methods, approaches, or how do you construct an intervention, but they are driving it based on the community need, keeping us honest always for community relevance and community impact.
Thank you, Susan. And while we have you on the line, I'm going to turn it over to you. So the stakeholder engagement continuum includes outreach and education, consultation, cooperation, collaboration, and partnership. How have you measured stakeholder engagement in your projects?
It's a great question, and as I was listening to the presentation and even thinking about getting ready for today, realizing, we probably haven't done it all that well. We say we do a community engaged participatory approach, and I think we really do. But in terms of measuring and documenting, it's sort of our driving ethos, and we've documented it qualitatively and with a shared commitment. But I know in some previous grant applications, we've been frustrated of well, gosh, why don't they recognize, that we do this really well, and that maybe some of the groups who are getting funded are newer to it or doing it in a more tokenistic or lip service kind of way. So I'm really intrigued by these tools that you've been developing, and I've been, thinking as you were presenting about how we can use these tools both to better frame the fact that we do real community engagement, but then also I would like some thoughts from the presenters too on if there are ways that granting agencies or grant reviewers might be able to build off some of the tools that you're creating so that when they are evaluating proposals that they can recognize, is this true community engagement? Is it, or is it some of those other models that you presented of doing community engagement, invite you to the table, but smile and nod when you talk and don't really use those perspectives? So I'm interested to hear what your thoughts are on how granting agencies might use this.
Well, this is Deb Bowen. The granting agency is comprised of two kinds of chunks of people. One is the agency itself and the policies and, the official line items for how they do business. And that one's a little harder, I think, because, granting agencies tend not to require the use of a particular measurement, for example. That's not usually built into the RFP. You must use the Goodman measure of community engagement, period. Sometimes it is, but that's very rare, relatively rare in my experience. Where I think we can make some dents in this, and maybe even help you with some of your previous frustrations, is the idea that when you say something is true, right, in a grant proposal, when you say something is true, my question as a scientist and as a reviewer, which is the other camp, my question to you as a reviewer would be, okay, how do I know that's true? Are you telling me this is true? Or are you, and again, not that science is the be-all, end-all of everything, but a scientific publication gives your statements weight. And it's one of the goals here in the past few years of work on our part. It's to be able to, when we did the systematic review, we thought, well, certainly other people have done this, right? Everybody's excited by this topic that we know. So of course they've developed measures that we can cite things and we can, not just a web link, not just a Google search, but actually a peer-reviewed publication, which is the trade of the realm here. That's what we've got to cite in order to say something is a true or not true statement. We need to, it helps make our case stronger if we're able to cite a peer-reviewed publication. And when we found that we could, in very few cases, cite a great, strong peer-reviewed publication that looked at how well the instruments were performing, we thought, this means we've got to do the work ourselves, because we need to be able to do that in order to convince, say, a molecular geneticist that what that's the measure of truth in science. It's to be able to cite other people's work that uses the same tool. So what we're hoping for our work and for your work and for anybody's work is that the more emphasis we place on the scientific background behind these measures, the stronger they'll be. And the more you can get your grants by saying, yeah, I went to the Goodman measure and I cited it and I used it. And so I know it's true because Dr. Goodman has a good tool and she's proven it and published it in a scientific journal. It sounds sort of superficial and silly, but that's actually the way the game works. So that's what we're hoping.
Thank you. And Rylan, turning to you for a minute, I'm curious, in your support of projects at your institution, have you heard how stakeholder engagement has been measured across projects there?
So I should disclose my sort of split hats, and I was recently in an academic setting doing research around care coordination for children with medical complexity, and now I've moved to AUCD where our members are doing research around the country, and now I'm wearing a sort of a policy hat. So now that I did my disclosure, I've lost the train of the question, so could you reframe that for me?
No, of course. Just asking, in your experience in either of the positions you just mentioned, how have you measured stakeholder engagements in projects that either you've worked on or your organizations have worked on?
Yeah, so that's a really great point, and it really builds off of the last response in that in some of the work that was funded through HRSA and maternal and child health, they would in fact call out measures which were required. And so it builds on the piece of, I think the real critical point, and in that case they were really interested in using tools that were created and funded in partnership with an organization called National Family Voices, which works on that population of families. And so it really speaks to the value of having a tool that has been validated and has some standing. And I'm frankly intrigued by the idea of a larger measure that could be used across all populations, and almost have, based on my previous experience of seeing the nice kind of outcomes of having tools that people were using and seeing how those worked across different sites in different states, and really moved the needle in terms of how authentic voices were engaged. It speaks to how critical this is and, what can come from it. On the flip side, there were other projects that were funded that not only didn't call for anything, kind of weren't that interested in hearing about it. So that sometimes is a challenge. I remember having, the fun experience in academia of multiple submissions and edits for different journal articles, and being personally challenged by some feedback to remove the stakeholder portion of why we got to that process and why certain questions were asked as not being as critical and valuable. So I think, today's conference really speaks to our collective work in changing the dialogue and moving things forward, not because it's the nice thing to do, but because it's a way that we can do really great work.
Thank you. So going back for a moment to some participant-driven questions, this question comes from Eileen. How do you keep measurement tools relevant as conditions on the ground change? And Melody and Deborah, I'll open that up to you first, but Shauna, Rylan, and Susan, if you have anything to add, please feel to chime in.
This is Melody. I think we're really trying to create a generic tool that could grow with partnerships over time. So our tool doesn't have a disease focus and it doesn't have a population focus. It's really just asking about things related to those principles of engagement. And we imagine that some projects will start off with minimal engagement but end with lots of engagement. Maybe you'll stay at minimal engagement throughout your study. So we're really trying to develop a measure that really just assesses engagement as a pure sort of construct, if that makes sense.
No, completely. And any other thoughts on that from our reactors?
I think the frame that's being used is really wise, because we did have some experience, again, with my point about language, that how individuals and families would identify shifts over time appropriately as our language evolves, and we're listening to what individuals' preferences are. And in some of the survey measures, the outdated language became a barrier to engagement and appropriate sort of measurement of how people saw themselves. So if they might see a term used around sort of a family's experience of disability or difference that wasn't viewed in the same way that they currently were framing things, they may not answer and move forward and as a consumer respondent in that way. So I like the broader perspective is wise.
No, thank you. And actually, would you mind, before we move on, would you mind clarifying what outdated language you're referring to?
So there's been this sort of often shift and almost, I don't know whether controversy is the right word, but whether in the pediatric population, whether it's a child with a special health care need, a child with a disability, a child with medical complexity, or a diagnosis-specific category, and how families and individual children or youth identify in those groups or don't. And some people have very passionate reactions, has been an interesting evolution.
Thank you. And then another question I wanted to put out there for Melody and Deborah and really any of our reactors is, developing productive stakeholder relationships can take time, and some of the best partnerships are long-term. So that being said, how can we balance that investment with the need to ensure that stakeholder engagement characterizes new voices in the relevant network?
Well, this is Deb, and one of the jokes that we used to tell ourselves when we pulled together stakeholder engagement groups around smoking cessation was that the best way to help someone quit smoking is to put them on an advisory group and say, please give us advice about quitting smoking and helping other people quit smoking, because usually people went, oh, I guess I should quit smoking. So in some ways, the continuing to search for new members and bring on new members, say, into a group or into a process or into the sphere of dialogue is a really good thing. And you would expect that as their engagement grows, then they would change their reporting on the measurement. And you can measure that, we hope, someday. I don't think we can quite yet, but we hope to be able to measure that and to be able to document that. That it takes a year to have someone feel very engaged and build that trust. Maybe that's a finding. We don't know that finding yet because we haven't had the tools to measure the engagement yet. But I think continuing to just simply involve new people and maintain the old ones. I mean, people also get tired and people develop other commitments in their lives and they're able to only participate for part of the time. And that's a normal, natural, healthy process of working at a community level. So I guess I think that those are pretty simple ways to do it, but those are ways that we've used in our projects.
And this is Melody. I think just to add on, I think what's been really nice about creating this measure is that the team of us have all done community engaged research. I think we're really clear about a lot of these nuances. And our measure is an individual level measure. So multiple people can be talking about the same project or partnership, but you're going to get an individual level measure from each person. So you'll be able to tell where your partnership is overall, but also if there's some people who are not as engaged as others.
This is Susan. I just wanted to add, I think it should also be purpose-driven. So reflecting on what the goals are of an individual project overall, but whose perspectives and voices are needed at different phases of the research. Not only do people's engagement shift, but people's capacities to engage in various phases of the research grow. So what we've been able to do as part of our work, as people's knowledge, skills, confidence grows, people have been able to assume different roles within project teams. And this is true of community members, just as it is with other groups. So then they're able to move into other roles. It's great also to have those strong relationships, but, there's this concept in sociology about the strength of loose ties as well, that there are advantages that come from not always talking to the same people about the same thing. So as a project team, being reflective of when do we need to get new voices in or whose voices are not reflected as part of the current dialogue. There's a nice model, the equity-focused knowledge translation model put out by Masuda and their team up in Canada that really does some of this work of looking very critically, reflectively at your team to make sure that you have different voices, different perspectives, and opportunities for those people, groups to step forward in meaningful and important ways.
That's a really smart point, Susan. I think that no measure is meant to be used exactly the same way in exactly all projects with exactly the same communities, exactly in the same path. And I think that thoughtful application would be, I think that's, thinking about things is generally a good idea. And so applying that thought to what you're doing and what each project needs. Maybe there are some projects that can be handled without 2 or 3 years worth of engagement. Maybe the projects are much more simple than we think. So I think your idea is to just think about what you're doing is a really smart idea, and not just to apply something only because it's valid and reliable. That's a really good reason to use it, but that's not the only reason to use it. So good perspective.
Yeah, and similarly, I was thinking about with your work, having a tool that you can measure and use over time, because people who do this kind of community engaged work know that it's a constant renegotiation and reinvestment in the process. And if we ever think that we're done engaging or building trust, or we've got things all figured out, we just don't. And it's important. I think that the being able to use a tool sort of repeatedly throughout the process can help, again, foster some of that reflection.
Thank you. And, Melody and Deborah, it's great that you have a measure of stakeholder, great engagement. I think we can all agree that this is much needed. Just curious, do you have any plans to use it in any projects that compare two projects or two sets of projects, where one project has high levels of stakeholder engagement and another does not?
So that's part of our psychometric testing. We plan to implement it in some of PCORI's existing projects. And like I said, we want projects across the spectrum. We want to be able to see how it performs when there's minimal engagement and when there's deep levels of engagement. And I think the other thing that it's important for me to mention is that our measure has no judgment in it. Like, just because you may fall into the community and the outreach and education bin doesn't mean that that's not where your study should be. We're just sort of defining things. We're not saying that every study should be in a full partnership.
Thank you. And, would you mind giving some examples of high levels of engagement?
So from some of the work that came out of our Delphi process, the partnership level was added. It wasn't on the slide that I showed. It was added in our Delphi process. And high levels of engagement, at least the way I understood it from our process, means you've worked with these partners on multiple projects. So moving beyond one project to have worked on multiple projects addressing an issue. So that's the highest level of engagement partnership according to our measure.
Okay, thank you. And I know that we're getting toward the end of our time here before break. And just before we close out things, tying this discussion back to Ann Bergen's presentation earlier, curious whether you, Melanie, and Deborah, or if any of our reactors have tied in stakeholder engagement as a measurable outcome in a logic model.
Well, sure. I would think that back to the earlier presentation, in Ann's presentation, I would think that this measure, once developed and once ready to go, ready to be pulled off the shelf and used, would make a great, what I think she calls a short-term outcomes. I mean, there are maybe other places to put it, but I would think that stakeholder engagement is often an initial thing to measure, outcome to measure, that you think will drive other things. So where it belongs is somewhere in the mediational process and somewhere in the middle, I guess. And I would look at it as a short-term outcome. That you can also measure it, of course, in the long run. That would be a great idea, because we hope that the engagement continues over time. But as a process outcome, I would think that we'd want to work very hard in the beginning of a project to engage all stakeholders together in the process of doing the project. And the decisions that get made out of that project will be better, we hope. So in terms of relating it to long-term outcomes, I would say it could be a short-term outcome would be a very simple place to include stakeholder engagement. If you literally go back to Ann's slide that had the words short-term outcome, I think you could stick it there and feel pretty confident that it fits there as well as other places.
Thank you. And Any other closing thoughts from any of our reactors or from Melanie or Deborah?
I think one thing that I've learned through doing this work with Melody is that this whole process of psychometrically defining a scale is both necessary and bewildering to me because it's very labor intensive, and just as stakeholder engagement is. And what we're hoping is that for key measurements, we do it and we get through that process, and it turns out that the tool is useful to other people. It's not for every tool. Every tool doesn't need to be validated. We don't have the time or the resources or the grants to validate every measure of everything that we use. But for those key measures where we're making claims like community engagement is important, community engagement is happening, community engagement is truly ongoing, then maybe spending the time or grabbing colleagues like Melody that can do this kind of work and understand it and produce it is essential. So maybe that's a way to evaluate when you read about different measures, what have those people done to provide psychometric data and convince you that this is a good measure? And if they haven't convinced you, I would say chances are that using it will be more complicated. Let's say that.
Thank you very much, Deborah and Melody, and thanks again to our reactors and for everyone for participating in the discussion today.